Hello, I'm Dr. Kevin Huguet. I'm a board certified general surgeon. I have fellowship training in minimally invasive surgery. I would like to review with you inguinal hernias today. The information presented here is the typical information that we go over during an office consultation. A hernia is simply a hole in the abdominal wall lining. This slide shows the external and internal view of a hernia. So the red is the muscle lining, and you can see where the intestines are pushing through the hole, which causes a bulge on the skin on the outside located here. So this is the outside, this is the inside, and here is where the hole is located, where the intestines or any tissue in the area pushes through that hole. Hernias can be located anywhere on the abdominal wall. Inguinal hernias are located in the groin region. Typically, we repair hernias laparoscopically. So we go in through little incisions and we push all hernia contents back down inside, and then the remaining hole is patched with mesh. So it's very simple. Think of it like patching a hole in a tire or a hole in the wall or something. We basically patch the hole and prevent anything from pushing through the hole any further. Surgery can generally be done through two different techniques. There's an open technique and a laparoscopic technique. I prefer to perform most inguinal hernia repairs laparoscopically. My preferred technique is a TEP, or totally extraperitoneal repair. This means that the surgery is performed in a space that is created outside of the intestines. The incisions that we usually use are located at the belly button, where there is an incision that's less than an inch, and two other incisions below the belly button that are approximately 1/4 of an inch each. The surgery is done with you asleep. It's a general anesthetic, and so somebody would have to drive you home the day of surgery. Afterwards, the incisions hurt for a few days, up to a week, and usually back to normal, I'd say, by about a week or two. The length of time to do the operation is usually about 20 minutes, and we do look at the opposite side during the operation. If there's a hernia there, we fix that at the same time. After making our incisions and placing the ports, a balloon system is placed in the space shown here. The balloon is inflated, which then creates the space that we perform the surgery in. The balloon system is removed, and then gas is inflated into this space so that we can see. If you're interested in watching this done laparoscopically through a real-life video that's narrated, you can do that on our YouTube channel as well, where we have a narrated video there. But basically, we create this space, we go in there with a camera and the other incisions, and we place mesh over the area where the hernias are located. The mesh we use is a polypropylene mesh, which is a plastic mesh. I've used this mesh in over 1,000 cases, and I've not had any trouble or problems with this mesh. I find this mesh to be very safe with a very low recurrence rate. My personal recurrence rate is typically less than 1%. We'll place the mesh over the area where the hernia is located. There's something called a direct hernia, which would be located here, and an indirect hernia would be located here. So once we blow up the area, we place the mesh on the inside, we cover it up, and then we deflate all of the gas, and then all of your organs kind of fall back on top of the mesh. Now the mesh is held in place with little metallic tacks that are placed along here into the muscle lining. Generally, the tacks don't set off mental alarms, and you can have an MRI. Those are frequently questions that patients ask. So the surgery is done with you asleep. It takes approximately 15 to 20 minutes. We do use a general anesthetic, so somebody would have to drive you home after surgery. Afterwards, your incisions hurt for usually a few days, up to a week. We give you lifting restrictions for any heavy lifting, which lasts for about 6 weeks. We will give you a handout in regards to what your lifting restrictions will be, but I would say most patients go back to work in a few days up to a week, unless they have very physical jobs, in which case sometimes you need to go back a little bit later. There are no special diets after surgery. There's going to be glue on your incisions, and that glue is something that's there for usually about 2 weeks or so. This is a typical handout that you would get at our office after surgery. It goes over all of our guidelines for exercise after surgery. I think if you follow the basic guideline to avoid things that hurt, then you won't cause any damage to your hernia repair sites. So basically, if you're doing an activity and that causes pain, if you stop that activity, you won't cause any further problems. The activity limitations go on for about 6 weeks, and try not to lift over 50 pounds as well. We do limit things like yoga or crunches or any core exercises for about 3 months after surgery, just so you don't cause yourself pain. One thing you might find in the long term with exercise over the first year or so is you might completely heal from surgery, and then after doing some really heavy activities, you may ache at the hernia repair site for a few days, and that's not unusual. We usually recommend ibuprofen if that occurs. So there are a few things that you might see after surgery, and so I'm going to list them here so that you don't get worried afterwards. First is swelling. Swelling occurs at the site of the hernia. It's a very common finding, and it is basically something called a seroma. A seroma is a fluid collection that develops at the site of the hernia location. It is a reactive process that occurs after you have repaired a hernia. The diagram here shows fluid buildup, which is the seroma. It's clear fluid. Mesh would sit underneath here, and the fluid is located where the hernia used to be. So the cavity that the hernia used to be pushing into is now covered up, and that space fills up with fluid and forms what's called a seroma. It's a normal finding and something that everybody with a hernia repair will get. The larger the hernia, the bigger the seroma that occurs. Large seromas can take up to 6 months or longer to go away. And initially it will be soft, and then it will become firm, turn into a hard knot, and then slowly dissolve over time. The seromas don't typically hurt, but it is alarming if you're not warned that this is something that will happen. In men, sometimes that fluid can build up in the scrotum, and if that occurs, we recommend that you just wear tight underwear. The other thing is bruising, and bruising is something that we occasionally see in the entire lower abdomen. It can also lead into the genitals. And this is something that doesn't hurt, and it's self-limited and should also go away over time as well. One last item I do like to cover in males is the possibility of urinary retention. That means that you're unable to pee after surgery. At the time of surgery, while you're asleep, we put a catheter in, and that catheter can sometimes irritate your prostate. So when you're asleep, you get a catheter in, and then we pull it out before you wake up. But sometimes the prostate can get irritated, and then you can't pee after you've had surgery. So typically, if you feel like you really need to pee and you can't, or you can't urinate after about 6 to 8 hours, the next step is to call my office if it's during business hours, or go to the emergency room, and a catheter will have to be replaced. Typically, we keep the catheter for up to 3 days and then remove it. And most of the time, it's in men that have an enlarged prostate that I see this problem. So what are the alternatives to surgery? Do you have to have surgery if you have a hernia? And that's a bit of a complex question, so it's best answered depending on your situation in the office. I can tell you that most hernias are repaired, and occasionally we will not repair them if a patient is sick or elderly and would not tolerate an operation. What are the risks of surgery? Well, surgery is generally very low risk. There are the typical risks with any operation, which include things like bleeding, infection, organ injury in the area that we're working. The bladder happens to be in the area that we're working, so there is a risk of injury to your bladder or the blood vessels and things leading to the testicles. All that would be less than probably 1%. There's a small chance of an open operation. Anytime we do surgery with little incisions laparoscopically, there's a chance of open surgery. And in my hands, that runs to be about 1 to 2% as well. Overall, it's a very safe surgery and generally very low risk. I think patients are generally very, very happy with having this done laparoscopically. I used to perform a lot of these operations through an open surgery, and I find the patients recover much better after a laparoscopic repair than an open repair. Another benefit that I see with a laparoscopic repair is a much lower chance of chronic pain at the hernia site. So that's one of the long-term risks that we go over with hernia repairs, is the possibility of chronic pain. This is something that happens more commonly with the open repair, where you may have a dull ache or even more severe pain chronically at the site of the hernia location after surgery. With an open operation, studies show it ranges anywhere between 5 and 15%. In my own population of patients, it probably is about maybe 5% of open hernia repairs. With the laparoscopic repair, I find that number is more like 1 or 2% of the time do people get pain at the hernia site chronically. And typically what it is pain that occurs, say, after you do something really physical. You can irritate the scar or where the hernia has been repaired, and it may hurt for a few days and go away. Sometimes it can be more substantial, but that would be a much lower chance as well. And then recurrence rate. In general, my personal recurrence rate is less than 1%. So that means the risk of the hernia coming back after surgery is generally less than like 1% or so. If you have any interest in watching the surgery as a live video that's been narrated, you can do that on my YouTube channel, Dr. Kevin Huguet, and watch a laparoscopic inguinal hernia repair that we've just discussed here. Well, I appreciate you watching today, and hopefully it answered a lot of questions, and I look forward to seeing you in the office.